Fellow citizens and residents, since last Thursday, November 24th, much of the local media chatter has been consumed by discussions surrounding a letter dated July 29, 2016, that originated from the Ministry of Health concerning the recruitment of 70 nurses from the Philippines with the aid of a Suriname-based recruitment services provider. The general tone and tenor of the public discourse on this matter are causes for concern on two levels. The first is the obvious lack of professionalism by the civil servant or servants who violated the regulations governing public service, recruitment and appointment of officers code, which require an oath of office and secrecy or affirmation of office and secrecy on appointment to an office in the public service. It is an obvious lack of professionalism by civil servants who broke the basic rules of workplace ethics by publicizing confidential information. This is an abhorrent act which should never be condoned or tolerated in any workplace, be it the private or public sector. Yet, it is the second level of concern with which the Ministry of Health and by extension the government of St. Kitts and Nevis take greater issue for the following reasons. The decision to recruit nurses from the Philippines is not a new practice by the government of St. Kitts and Nevis. To be precise, government has been in the habit of recruiting nurses for years. In the past 5 years alone, starting in 2011, during the former Labour administration, a total of 27 foreign nurses have been hired. These nurses were recruited from countries such as Nigeria, the USA, Cuba, Taiwan, St. Vincent and the Grenadines, Guyana, Santo Domingo, and the Philippines. All foreign nurses who have been recruited to work in our federation provide specialist skill sets currently lacking among our local nursing fraternity, especially oncology, hemodialysis, intensive care, and mental health. The recruitment of foreign nurses with specialized skill sets is meant to build capacity among our local nurses and in time have knowledge transfer so that the foreign nurses can be repatriated. This system works. For example, it was Nurse Mary Manibog from the Philippines, who is no longer here with us, that assisted greatly in 2012 in the establishment of the hemodialysis unit at JNF, a department that is now ably headed by a local assistant nurse manager. We anticipate similar results with the two newly recruited nurses for oncology, the newest department at JNF, for which another local nurse manager will be the head. Based on government's experience over the years, it has been discovered that nurses from the Philippines are top quality, hard-working performers. Hence, the reason for more Filipino nurses being hired than their counterparts in other countries. Government's recruitment of foreign medical personnel is not limited to nurses. We have for years also employed foreign doctors, a large majority of whom have been recruited from Cuba, and bring specialist skills to the Federation that are either absent or in short supply locally. This is what sensible governments do to ensure that their people receive the best care possible in spite of limited local resources. The salary packages being provided to the nurses recruited from the Philippines thus far, that is 12 out of 17, is in no way out of the ordinary. Every one of these nurses possesses a comprehensive bachelor's degree in nursing, plus postgraduate certification in their area of specialty. As such, they are paid at K33, the normal benchmark for civil servants with a bachelor's degree. It should also be noted that the matter of a housing allowance of $500 that has been paid to the nurses is also in keeping with the statutory rules and orders of the civil service, in particular, number 8 of 2014, section 38, subsection 8, overseas appointments and travel arrangements, which clearly state that foreign workers recruited by the government of St. Kitts and Nevis must be provided with accommodations at the government's expense. I must emphasize that these SRNOs would have been passed into law by the previous administration in 2014. Therefore, this team unity government is simply carrying out the letter and spirit of the civil service regulations that are already in place. The federal government considered it rather unfortunate that so much time and energy has been consumed with this issue of foreign nurses recruitment that has, for the most part, been deliberately and hypocritically slanted to achieve political advantage and disgruntlement. The public deserves to know the truth regarding government's need to occasionally recruit foreign medical personnel to meet the specialized healthcare needs of our citizens and residents. As we add more services such as an oncology department for cancer treatment and a new mental health day treatment center, it is obvious that our need for specialized skills would increase. In the case of the latter, it must be noted that there are no more than 4 mental health trained nurses in the Federation to serve a population of 50,000 people. It is obvious that where required skills are lacking, the government has an obligation to recruit the requisite workers while we train our local cadre of nurses to meet the growing needs of our people. It takes 4 to 5 years to train specialist nurses, and the necessary academic foundation must be in place. To do nothing would be irresponsible. It is the government's greatest wish that more of our own people would take stock of the urgently needed medical skills and seek out opportunities for further training and qualification in these areas. In this way, we will do much to advance our competitive advantage as a people while we build capacity in critical areas of healthcare delivery. Thank you for listening.